all of you. We're just letting people into the waiting room, into the webinar slowly, so everyone will be in soon. Is everyone in, Norma?
I think you can start, Claude. Almost everyone is in, but I say you can start.
Okay, so welcome to another webinar in our series of webinars organized by the Association of Speech Language Pathologists. We're very pleased to have with us for this webinar Step Up for Parkinson's. Just a few things I would like to mention is that the microphones will be on mute throughout so that we can avoid any background noise. Also, we will be taking some screenshots during the webinar and also recording the webinar. We would appreciate you to keep your videos on, but I mean, if anybody would like to switch them off for personal reasons, this is entirely up to you. We would like as well to mention that, I mean, you are welcome to like our Facebook page. It is ASLP. Also, you could like the Step Up for Parkinson's Facebook page and the websites as well. As an association, we are also issuing a newsletter, which comes out monthly, which is, has gained popularity and is of a lot of interest to a lot of people. So we encourage you to have a look at that as well. We will be taking questions at the end of the webinar. So if anybody would like to use the chat function at the bottom and write any questions, we will take note of these and put them to the presenters at the end of the webinar, and they will be more than willing to answer the questions. We will be sharing some presentations and reference lists by email after the webinar, but we do encourage you to take down any notes throughout if you would like to. So this is at your discretion. At this point, I would also like to announce that on the 8th of July, we will be holding our last webinar in this series of webinars for now. It is going to be on 8th of July, and the title is Increasing Complexity, Grammar Use in Maltese-Speaking Children. We'll be sending you more information about this as well. We'll be then having a little well-deserved break. And at this point, I would like to thank all the committee for all their hard work throughout these webinars. And we will be back shortly after a little break with some new webinars. So without further ado, today we have 3 presenters with us. The first one that we're presenting is Miss Natalie Muschamp. Natalie is the founder of the organization of Step Up for Parkinson's. She originally studied dance in the Netherlands and obtained her master's degree by research in dance studies at the School of Performing Arts at the University of Malta. The aim of this practice as research project was to establish and explore the specific ways in which creative and expressive movement improves the quality of life for people with Parkinson's disease and their caregivers. The first contact with Parkinson's disease was within Natalie's own family, and when in 2015, Natalie became aware of the Dance for PD program, New York, and she felt compelled to help people with Parkinson's disease and their carers through dance movement in Malta. In 2017, Natalie founded the voluntary organisation Step Up for Parkinsons, which currently has 190 participants and hosts 10 classes per week in Malta. These classes are held free of charge. In 2018, the organisation received funding by winning the second prize at the Malta Social Impact Awards, and Natalie received the JCI award for her work with Step Up for Parkinsons. On the 13th of December 2019, Natalie received a state award honour for her service to the Republic of Malta during Republic Day. So I will now leave it in the hands of Natalie to continue. Thank you, Natalie.
Thank you. Can everyone hear me? Yes, I think so. So I want to obviously first thank the organization for inviting me and for highlighting Parkinson's disease and Step Up for Parkinsons. And so I'm very happy to be here today. Also very happy to be here with our team members, Roberta and Amy. So she did a very great introduction. So basically, I want to talk a little bit today about my research. It was basically about how artistic and expressive movement can improve the quality of life for both the person with Parkinson's disease and the caregiver. And so I will slowly start explaining how and why. I'm going to share now my presentation. So, okay. Here we go. So basically, as already mentioned, the title of my research was Improving the Quality of Life for both the person with Parkinson's disease and the caregiver, the contribution of movement as an artistic and expressive medium. Today I want to talk a little bit about Step Up for Parkinsons, obviously, people with Parkinson's disease, the caregiver and the role of the caregiver, which is hugely underestimated, why dance, artistic and expressive movement, and there's a few references about the research and our contact details. So Step Up for Parkinsons, as you already mentioned, we host free specialized movement classes for people with Parkinson's disease and their carers. These classes are free of charge, as I truly believe that everyone should have the opportunity to join these classes as they are proven to improve people. And also, if we start charging, then you decline certain people, and I just believe it's very important. Also, latest research has shown that Parkinson's disease, there's a pandemic of Parkinson's disease, actually the fastest growing neurodegenerative disease in the world, which is just recently a book has been launched about that, and then Parkinson's disease. And so it's very important that these movement classes are there to improve the quality of life of those living with Parkinson's disease, because it's not just approach for the person with Parkinson's, but also for the family members. The methodology that we use in the organization is based on existing and current research, but as with any kind of therapy and movement, it's an ongoing process of researching and learning and observing, which is great. As you already mentioned, we started a pilot in 2016 with Amy, who's here as well. And then we started an official organization in 2017, and we grew very, very fast. We had 15 participants, and then now about 190, but of course, due to COVID, unfortunately, we've had to do everything online. We haven't been able to meet because we have to protect participants, cancel theater tours, etc. So hopefully we can go back and soon meet each other again. We have a great team of great teachers with different backgrounds. Most of them work in healthcare, healthcare practitioners, or a background in dance. So yeah, very, very beautiful team. So as already mentioned, that there is actually a pandemic. Parkinson's disease is the fastest growing disease in the world. And what actually is Parkinson's disease? And people often ask me, oh, is Parkinson's disease the disease in which you lose your memory? And it's not. Parkinson's disease is has a dopamine deficiency in the brain. And because of this, you can have physical disability, so you have problems initiating movements, so you have motor impairments, you can have the tremor, you can lose your facial expressions, your voice, but besides the physical aspects, Parkinson's disease also has non-motor symptoms, and these are often overlooked, and that can be sleeping problems, anxiety, depression, isolation, and that these things are really important to look at and how we can improve. So then also, obviously, a lot of people often think that Parkinson's disease is only a disease for the elderly, and it's not. There are a lot of people with young onset Parkinson's disease, and I hope that with these kind of presentations, if you know anyone who's younger, to encourage them to join either our organization or the Malta Parkinson's Disease Association. It's important that we reach out to people with Parkinson's disease who are younger. They often don't want to come to the organization, possibly because of stigma. And so if you know anyone, please tell them to come to the MPDA or Step of Parkinson's. So the complications that come with Parkinson's disease on a long term, because people have physical disabilities, and there's different stages of Parkinson's disease, and eventually sometimes they need to be taken care of through a caregiver or into a care home. So Parkinson's disease is not just, does not just affect the person, but it affects the family, it affects the whole environment, the whole world basically. And so it's very important that we make a lot of awareness about this. I can continue talking forever, so I'm just going to go to the next slide. So the caregiver. This is a subject for me that I think is very important. I think, as I already mentioned, you don't have Parkinson's disease on your own. If your husband or wife gets Parkinson's disease, this means that suddenly if the husband gets Parkinson's and the wife is looking after the husband, it means that you kind of lose your identity. One becomes patient and one becomes carer. And it's important to keep their own identity and to also feel a sense of agency and belonging within society. But we are not, none of us who are not informal caregivers are not trained to be a caregiver. And how can you find that balance? And how can you not lose your agency within the society and your own identity because you are still Joey or Carmen or etc. So this is very important, and that's why I really advocate that our classes are for both. So our classes are for both because I truly believe that when you come with your partner to the class, you first of all meet people who are just like you in the same situation, and instead of having to look after each other, you can relax, let go, and dance together and actually reconnect in a different way through artistic and expressive movement. So back to the caregiver, there is physical and mental distress, has a negative impact on overall quality of life. And also there isn't enough support for caregivers in general. So let's not just talk about caregivers with Parkinson's, but we can go into dementia, Alzheimer, cancer. Just at one point in life, we will all be a caregiver. Why dance? Because it's amazing. So basically, if you think about it, when you have Parkinson's disease, you have difficulties initiating a movement, your body becomes stiff, you have less facial expressions, and dance basically works with all of this. You strengthen your upper body, we practice gait, we strengthen, we stretch our limbs, we work on facial expressions, we work with sound. So it's everything that becomes difficulty within Parkinson's disease, the sense of proprioception, where am I in space and time? These are all things that we address and which is included in the methodology with Step Up for Parkinson's. These are everything that we do has an aim and an objective. So everything that we do is, okay, we need to work on strengthening, we need to work on stretching of the body, we need rhythm, hey, let's work on memory, because it's not just follow the leader within our organization. We also make sure that they have creative tasks, so they learn how to problem solve. And when they do these things, when you create your own dance and work on performance, you get your sense of self-esteem back. You know, a lot of our participants never used to dance before, or never thought that they would dance, and suddenly they're on stage, you know, together. So it's much more than just movement, but dance is important. It's proven also to help. There's been a lot of research done, and also recently the World Health Organization actually addressed that movement, dance for Parkinson's, is actually really good. Now, artistic and expressive movement. So the methods, I just posted a few methods here because I could go on and on about this, and I don't think 15 minutes is enough. So what we do within a class that really focuses on the artistic and expressive movement, so looking how can they express themselves and involve and create their own artistic initiative, feelings, and why is this so important? So when you have Parkinson's disease, you often have no more way of expressing yourself. Your body doesn't do what you want anymore, you can use your facial expression, your voice. Now, if you are in a room with music and everyone around you is the same, and you understand a few movements, and the music is taking you with you, it's going to give you a certain feeling. That's why music is also a very important component within our work. So through dancing and movement, they suddenly become something. They can dance, they can move. And so within the methodology, we often first we explain, if someone comes to the class, what is movement, what kind of movement dynamics do we have, how do we learn how to dance, and then eventually when they have a bit of a vocabulary of dance, we teach them creative tasks. And these are tasks in which you put them in groups. Sometimes you separate carer and the couples, or to give them some space. Sometimes it's nice, or you put them together, depends on the moment. And you give them certain elements or a theme and music, and they create their own piece. And this is really great because they think for themselves, they realize how creative they actually are, and then you let them perform it to each other, and that gives them self-esteem. So so, and also what we do is we use mirroring. There has been research, but not enough research yet to prove that through mirroring, we actually can improve the neuroplasticity in the brain. And mirroring are exercises in which you sit across from each other and you really just mirror the movements. And this is also a great exercise to connect, because connection is also a very important element within Step Up for Parkinson's. So as I already mentioned, outcomes, self-esteem, improved sociability, and improved quality of life. And my research was based on well-being and sociability, quality of life, and being in a group and being with all these people around you, who you become friends with. You look forward to this. I look forward to this. They are my family. So it breaks isolation, it breaks depression, and it can help against anxiety. Also, one thing that I would like to note in our methodology, which is very important too, because often people have anxiety, is we incorporate mindfulness and breathing exercises at the beginning and ending of the class. So, so they can use this, and we give them coping mechanisms to use at home. So here you can see a few photos of the wonderful family that we have. And as you can see, it's one big family, and it's all about connection. Dancing together, having fun, laughing, and feeling that you belong. There are some references. Now I would like to show you a little video. I'm not sure where I am at the time. But okay, so this is a little video what I'm going to show, and this is actually in one of our classes last summer. And it's a creative task. So I told them, okay, we're going to put the music on, and I'm going to point out who will be moving, and they have a certain task. So they have to freeze at one point, connect with each other. But the rest is kind of free moving, because free moving is also important, to feel how you can move and to connect. So I'd like to show you a little video to demonstrate how good they are.
Paolo?
video is not showing, Natalie, I think.
The video is not showing?
No, I'm not seeing it, no.
Oh, okay.
You need
Are you
to stop
guys seeing the
sharing
video?
this one. You need to stop sharing your presentation, I believe.
Okay, stop sharing. Okay, here we go. And then I go here.
Yes.
Okay, okay. So here we go. Paolo?
Try and have freezes in between when you stop moving. Try and stop moving too. Remember, it's a conversation. Freeze, everybody. Freeze. Michelle, start moving. And the rest, slowly. Everyone freeze. Pierre, only one moving. Pierre. Maria, join in. Elizabeth. Valerie. Joey. Everyone move in. And freeze. Well done.
Okay, and so now I go back here. Oh, how do I stop share? Okay, great. So, yes. Sorry, I haven't seen them for such a long time. Seeing them almost just gets me into tears. So as you can see in that video, how these are people with Parkinson's disease, and they often have troubles with walking, and it might be overwhelming for them to walk in a group. And if you see that video, they are all comfortable. They're walking around each other. They have forgotten about Parkinson's for a moment. And that is through connection, through having a way to express themselves and to, expression, definitely expression. So that is what I wanted to say. And I hope that soon we can all meet again, because it's horrible not. And I hope that we can continue with the organization and continue helping people. And if you have any questions, let me know. Thank you.
Thank you very much, Natalie, for very interesting and for sharing that lovely video with us. Shows you're very passionate about the topic and creating a lot of happiness. So very admirable work. Thank you for sharing that with us. Okay, we're going to move on to our next presenter, who is Miss Roberta Said, who is a speech language pathologist. Over the past 12 years, she has worked within a community school and acute hospital setting. She's now working solely in acute hospital setting. In 2016, she finished reading for an MSc in neurological rehabilitation at the University of Plymouth. She also leads the specialized interest group in acquired neurocognitive communication disorders, that is dementia, within the Speech Language Center. This group aims to enhance other professionals' knowledge about dementia, as well as support the individuals with dementia and their carers. She has always been interested in progressive conditions, namely Parkinson's disease and dementia. Hence her research in assisting and supporting these individuals and their caregivers. She is also currently part of the Step Up for Parkinsons and the Dr. Clown Voluntary Organisation. So thank you, Roberta, and welcome to the webinar, and we look forward to listening to your part now.
Thank you for inviting me over, and thank you to Natalie as well for giving me this opportunity. So now I'll share my presentation. So basically, I will be talking about how Parkinson's affects communication and swallowing. First, I'm going to start with a video. So let's see whether this works. I have to minimize presentation. YouTube. Share. Are you seeing the screen?
We are, yes, we are.
So,
Parkinson's is a condition that affects the brain. It develops when cells in a particular part of the brain stop working properly and are lost over time. These brain cells produce an important chemical called dopamine. The brain uses dopamine to send messages to help control movement. Everything from walking and talking to writing and even smiling. Eventually, the brain cannot make enough dopamine to control movement properly. This is when symptoms start to appear. These problems can be subtle at first, like handwriting becoming smaller. But as more cells are lost, problems with movement get worse, and some people may also experience other symptoms. We don't fully understand why dopamine-producing cells are lost in some people and why people get Parkinson's. But our researchers are working hard to find ways to protect these precious cells so we can develop better treatments and one day a cure.
okay, so that was stop share. So that was a brief introduction on what Parkinson's is all about. Now I'll be going into how it affects overall quality of life, how it affects communication and swallowing, and I'll be going over some therapy options which are available. So basically, Parkinson's has, as Natalie already mentioned, non-motor symptoms and motor symptoms. When we're talking about motor symptoms, we're referring to stiffness, slowness, tremors, difficulty with balance and coordination. And we also have non-motor symptoms which are usually invisible, and they affect the autonomic system of the individual, which usually controls our sleep patterns, our bowel movements, our perspiration patterns, our mood and our thinking, and physical changes such as, for example, the ability to carry out an activity, or even skin changes, and other habits like even feeding habits. Considering this, we have to keep in mind that these symptoms are co-occurring, and obviously they may vary because the condition is a progressive one. And now we're going to go over to another video telling us what are the possible causes of Parkinson's. So stop share. I'm a bit slow at this. So, Parkinson.
We don't fully understand why people get Parkinson's. In most cases, we think it's due to a complex mix of factors. Things in the world around us and our lifestyle can affect our chances of developing the condition. For example, exposure to certain chemicals can slightly increase risk, and exercise may decrease risk. But the biggest risk factor is age. The vast majority of people will not have directly inherited Parkinson's. For some people, an inherited change in their DNA may be involved. Our DNA is made up of lots of sections called genes. There are genes responsible for eye and hair colour, and that can influence how tall or short we are. And scientists have identified changes in a number of genes that are linked to Parkinson's. But most only slightly affect risk and don't mean someone will definitely develop the condition. We're still building a picture of why people get Parkinson's, but understanding the pieces of this complex puzzle will help us unlock better treatments and one day a cure.
Okay, so now we're going to move on to how it affects the brain. Oops, sorry. So basically, as we can see, there's that purple structure in the middle of the brain, in between the cerebral hemispheres, and that is the basal ganglia. It is what controls and what produces the stuff we need to move, the dopamine, basically. So it's made up of these parts. There's the globus pallidus, there's the putamen, the caudate nucleus, and the substantia nigra, and there's also the thalamus and the subthalamic nucleus. And basically, when there is no Parkinson's, you have the substantia nigra, which is stimulating the dopamine neurons to produce dopamine. But obviously, in the presence of Parkinson's, the dopamine neurons are affected, thus dopamine dopamine production is affected, and this in turn affects their balance and other factors. So now we're going to speak a bit about how it affects speech and language. As we all know, when we have persons with Parkinson's, they usually present themselves with atypical disfluencies, such as the examples given here, like blocking, pauses, prolongations. Their verbal language sometimes is slower than usual, and it's not always as accurate. And you also have effects on the verb production and the way they formulate sentences, the syntax comprehension. And sometimes you also have word finding difficulties, which are most likely due to maybe cognitive deficits, which might develop later on in the condition. You've also got dyskinesias, which relates to slow speech, dysarthria, which is which affects oromuscle strength, thus affecting the articulation of the individual, how clear the person is speaking. Dyspraxia, that is how able they are to initiate language. It also affects voice because obviously the respiratory support is affected, and memory. Now, with regards to memory, various types of memories are affected. You've got the working memory, which is related to the short-term memory, that is items you need to access there and then to do an activity. You've got the executive memory, which generally helps in accessing long-term memory for you to be able to do something in the now. And the procedural memory, which generally helps you do everyday tasks like walking and driving. Obviously, not all individuals are affected in the same way, and it does not always depend on progression. And some research is also stating that if there are cognitive deficits, there doesn't necessarily have to be a language impairment. But obviously, this is still an ongoing research, and there are other researchers who are contradicting this. And obviously, as the video already stated, age is a risk factor. Now we're going to go into how it affects voice. Basically, as already mentioned, Parkinson's disease affects the way we, the way they support themselves for breathing. So it affects all these areas of speech. Phonation, the way you speak, prosody, how you intonate your language, how clear your voice sounds, whether it's hoarse or breathy, how loud, and as already stated, the clearness of the voice quality. This obviously is due to poor respiratory support, which leads to poor speech intelligibility. You've also got effects on swallowing. Over 80% develop some kind of swallowing difficulty as the condition progresses. Usually it's related to difficulty with liquids or food or various consistencies of food, which obviously affects their quality of life, because if you have these problems, obviously these may lead to chest infections, weight fluctuations, and obviously this needs attention. So if one notes these difficulties, you have to refer to your doctor so that they will guide you accordingly, because obviously this might lead to difficulties with oral nutrition. It's also important to look out for other conditions like reflux, poor oral care, because these might also influence how well the person will be eating and drinking. Now, with regards to therapy, there are various amounts of therapies available. I'm just going to focus on some of them. I'm going to look at therapies which will focus on speech, on voice, and then on language. So with regards to speech, there are some oromotor programs which focus on strengthening and improving the strength of the oromotor structures, such as the tongue, the cheeks, the lips. And basically they're based on block therapies, which focus on enhancing endurance with regards to these areas of the face. There's also this oral motor exercise program. It's called Oral Light System, whereby they use these, they look like spoons. They are spoons, in fact, but they serve for a different function. Like, for example, you've got the spoon with the hole in the middle. It's there to improve tongue strength. So you put your tongue on the spoon and you press your tongue either against the roof of the mouth or the bottom of the mouth. You've got the link on the website on the slide, which really guides you on how this therapy is carried out. And obviously, if this is chosen as a therapy, the person needs to buy the spoon. So obviously they'll be personal, you can't share these. This website is available, not website, this link is available on the resource list I forwarded for it to be shared with those attending the webinar. Then obviously you've got other therapies which address language in general, like alternative communication, such as communication passports, visual aids. You've also got group therapy, which help, and memory classes. I know that Caring Rec hold yearly not memory classes. There'll be like information sessions for both the caregiver and the person with dementia, for them to enhance their knowledge about the condition. And then you've got therapy on voice. Now I'm going to talk about the Lee Silverman. There are other therapies which are available. It's not just the Lee Silverman is the only therapy which exists, but this is the one which is mostly evidence-based, and it shows that it works, especially when you have persons in the early stages of Parkinson's and persons who have just idiopathic Parkinson's. So ideally, the person does not have any multiple comorbidities, because that is when it's most effective. It focuses on phonation and sensory awareness. It's a block therapy, so ideally it's done over a period of a month. It's on 4 sessions, 4 times a week for 1 hour each, and the person also has to do a number of exercises at home. And it basically focuses on producing the vowel ah in a sustained way, in a high intonation and a low intonation, and then you transfer this voice production technique onto functional phrases. That is, the person chooses a number of phrases they particularly say during the day, and they practice using the loud voice whilst reading these phrases. It basically focuses on these concepts. So as I already mentioned, you've got high effort productions, that is production of the ah and the high ah and the low ah. Intensive delivery because it's a block therapy. Multiple repetitions, so it's not complicated for the individual to remember and to practice. Here obviously you also have to keep in mind the cognitive abilities of the individual. And it focuses also on obviously on voice and on calibration. By calibration, I'm referring to how able the person is to monitor his own voice output. So for example, if the person speaks and his voice is not at the optimal loudness level, this type of therapy allows them to realize if their voice level is not clear enough. So they basically improve their own voice according to how it sounds. I already stated this. Basically, it aims to focus on the respiratory and laryngeal muscles by stimulating and training loudness. Research indicates that there is maintenance up to 12 months post-treatment. And there are also researchers who looked into research where they identified that it also improves swallowing function, because obviously you're using the muscles in all the muscles in the area related to swallowing. So now I'll be demonstrating another video. So let's see and show.
Any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can.
Ah.
Would you say Parkinson's disease has caused you to talk less?
Yes.
Because?
Because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to me because they can't hear me. Until I get mad and then yell.
Take a deep breath and say ah for as long as you can. Ah. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my
Good for you. That's excellent. What practicing do you do at home?
my eyes and my lows, and I read out the mail out loud.
Excellent. You feel like practicing helps?
Oh, yes.
Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "Why I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh, yes, I set some of our friends back when we went to their house and I talk loud. Lou says, what the hell happened to you? My daughter said, oh, Mom, that's you? Good. Don't you feel wonderful? Oh, yeah, because now she can't say, I didn't understand what you said. No excuses, right? Yeah, no excuses. All right. So what do you do when you want to be as easy to understand as possible? Think loud. Do you notice any changes in your speech?
So that was a typical improvement, okay? You don't get improvement with all patients like that. That's a really typical one, but it does make a difference because it gives the person a voice back, especially if they have a very low voice and before they were really sociable people. And all of a sudden, as Natalie was mentioning, they become socially isolated because they realize that they cannot be understood. And they literally close in on themselves. So they just remain at home and not socialize with others. So it does give them a breath of fresh air. I'll be moving on to some therapy on swallowing. As we all know, swallowing, you usually do a bedside evaluation and you see whether you need to advise with regards to the compensatory strategies such as posture, any feeding techniques they might utilize which might help their swallow, and maybe even modify their food and liquid consistencies. And also whether they might need any objective assessments like fees or video fluoroscopy and monitor as needed. It's also important to mention the deep brain stimulation. Now, this is a surgery which is being done quite often by persons with Parkinson's. They do not all qualify for it because obviously the neurosurgeon would have to refer you and see whether you would benefit from it. It is important that when you have people with Parkinson's who are going to undergo this type of surgery, it does not necessarily mean that it will improve their speech. It might improve their movement, even though there's a bit of conflicting evidence about that. But it does not necessarily mean that it will improve their speech, especially if you've got both electrodes being stimulated in both areas of the brain, because that might lead to another kind of dysarthria, which will not help the speech. A team approach is always important, and obviously support both for the persons with Parkinson's and their caregivers. And I listed some support services available locally, which are useful for any individual to know about, especially if they receive patients or clients with Parkinson's. There's the Malta Disease Association, as Natalie already mentioned, Staff for Parkinson's, Caring Rec, Community Care and Support, Speech Language Center as well, and Centro Servizzi Anziani. I also shared a resource list with you. Natalie will probably be forwarding it to you unless she already has. You will find a number of references there which are really helpful, and they're documents you can download and use. Even you can do online courses which are free. And I think it's a really good resource list which you can refer to if you have any free time. And that was my part of the presentation. Thank you. So.
Thank you very much, Roberta. Not easy to put all of that into the limited time that we have.
No.
As you mentioned, the reference list will be forwarded to your email addresses after the webinar. They will be forwarded on the email address that you used to register for the webinar. So you will be receiving them later on. Okay, we're now moving on to our third presenter, who is Amy Dimech. Amy Dimech is a physiotherapist with 12 years of clinical experience as well as academic experience as part-time tutor examiner and dissertation supervisor with the Faculty of Health Sciences, University of Malta. She focused both her undergraduate and postgraduate dissertations on dance science, having studied classical ballet for over 20 years. She is also a registered ballet teacher with the Royal Academy of Dance since 2013, a freelance Pilates instructor, and has been part of the teaching core of the Voluntary Organisation set up for Parkinsons since 2016. She successfully managed to combine her clinical profession with her dance teaching career through dedication and her passion for dance and movement. I'll leave it in your hands, Amy. Thank you.
Yes, hi to all. Nice to see some familiar faces. As you know, I know some of you from CDAU, which is where I'm currently working in the children's department. Some of you I Jess. Nice to see some of the participants from the classes. Yes, as a physio, I work mostly with adults, yes, in neuro and orthopedics. That was the bulk of my experience. But recently I've been working with children. Yes, and dance, as Claudine explained, has always been part of my life. So let's go. Feel free to stand up if you want to move a bit till I get this going. Shake your legs. I haven't stopped moving. That's why I switch off my camera. Okay. I think you can see it like this, yes? Yep, okay. Okay, so my first slide was actually about PD symptoms. I have to admit, I added speech and swallowing issues as we started the presentation. Totally missed that bit because as a physio, totally focused on limbs and body. I don't think I need to go over this. Yes, we sort of said this in the other two presentations, but there's the motor and the non-motor symptoms. And of course, as physios, we tend to focus a lot on the motor symptoms. Just to explain a bit, Roberta gave us a bit of the physiology behind it. So when you go and reach for a glass, yes, you don't overshoot. You get it, yes? When you stretch your arm, you know exactly where it is without thinking. When there's this dopamine, yes, you lose it. And that's why you tend to overshoot. That's why there is the tremor. So the quality of movement is altered. The slowness, as both Natalie and Roberta explained, is the lack of initiating. The accelerator pedal, yes, the go pedal, that's altered. Now, as a physio, we have to look at it from 2 points of views. So the actual exercise, this is tailored to each individual, yes, following an assessment. As we know, both as people with Parkinson's and of course as clinicians, yes, no patient is like the other. So our input is tailored. But as a physio, there's the other side to it, and that is general physical activity. Now, as you know, every person needs to be active. Yes, the recommendations are 30 minutes daily, or 30 minutes daily. Yes, you need a maximum of 150 minutes weekly, so 2.5 hours in a week. When we're having movement issues, and we generally, yes, are mostly sedentary, just think about the last few months, yes, when we were stuck indoors. Every person needed to reach those recommended goals. So as a person with Parkinson's, you have an added burden. Yes, think of us who, yes, maybe do not have physical issues, and we still find it hard to meet those recommended goals. Yes, there is an added hurdle that as physios we need to try and overcome with our patients. it is important for very, very many reasons. Yes, and it is broad over a number of spectrums. Let me just see if yes, perfect. Okay, so again, we would start with our assessment, and both the assessment and the management would be, so I'm going to go into this a bit more in detail. The physical activity aspect, yes, the PA, and the exercise. So when it comes to physical activity, we have to help them change their personal health behaviors. Okay, so yes, Mr. Dimech, yes, why does he find it hard? How can I help him to increase his number of steps, for example? Yes, how can I help him to actually start moving or leaving the house? And you're going into functional independence as well. When we come to the exercise, and this is where it's more tailored, we're going into what we call the FIT principle, so the frequency, the intensity, the time, and the type. So for example, there'll be, again, Mr. Dimech, who needs, for example, to focus more on his lower limb strength or his trunk stiffness. Yes. And movement strategy training, again. Is it the slowness that is affecting them mostly? Is it the loss of balance, the falling? Yes, and then we help them in that respect. We also go into the use of walking aids, transferring techniques, balance strategies, force education. Yes, this is a big part we need to focus on to prevent further comorbidities, and the practice of manual activities. Yes, this is, and then together with the OTs, you know, practicing dressing, undressing, buttons, stairs, you know, the everyday, day-to-day stuff. So at the beginning, we would emphasize on education and self-management, yes, giving them the tools to cope from the start, promoting physical fitness and specific exercises, which can already start to offset the effects of PD and minimize further regression and regression in strength, flexibility, and balance. Later on, we may need to incorporate, when there's maybe a bigger struggle, we incorporate cues. Now, it could be auditory, tactile, visual, or sensory. This is where all the other things that both Natalie and Roberta mentioned come into it. So auditory, counting, cues, music, tactile, you know, that little nudge. Visual, something to focus on. Sensory, yes, maybe touching that body part, things like that. And of course, internal. Yes, internal cues, counting in your head, things like that. There's also an added aspect, and that would be pain management and respiratory function. There's pain maybe from stiffness, maybe back pain. Again, someone with Parkinson's doesn't mean cannot get sciatica. Someone with Parkinson's can still have heart disease, still have a pacemaker. Yes, still can have just a simple muscle tear in the shoulder. Yes, so they can have shoulder pain, frozen shoulder. This has nothing to do with the Parkinson's. But of course, treating it is a bit different. Managing it is a bit different. And respiratory function for a number of reasons, again. So yes, everything is sort of interlinked. Maybe from the lack of movement, maybe from the kyphotic posture, yes, the loss of expansion, the loss of, yes, maybe because you're less active, yes, you're not taking those deep breaths, or you're not clearing out your lungs, you tend to get infections. Yes, it's quite broad. So that's why physio tends to be multimodal. Yes, we use different techniques because of all the different components. Whoops, sorry. So this is a video, and it's the same source of Roberta's. The video is actually for people with Parkinson's, so it would be shared. It's from a support group in the UK, and it would be shared for people with Parkinson's to help them. I'll show it to you, and I'll just make a few comments. Just let me know if you're hearing the sound.
If you have Parkinson's, regular exercise can keep you healthy and make you feel happier. It will improve your balance, posture, strength and flexibility, and also help with sleep, tiredness, your mood and mental health, especially if you exercise with others. Yippee! So focusing on exercise can be as important as your medication to help you take control and manage your symptoms. In fact, research shows that doing at least 2.5 hours of exercise a week can actually slow the progression of your symptoms. There are specific exercise styles to focus on depending on how Parkinson's affects you. When you were first diagnosed, you may have carried on with your usual activities and exercise. As your Parkinson's progresses, you might notice your symptoms affecting your movement, posture and balance. Make sure to talk to a physiotherapist who knows about Parkinson's for more advice and to plan the right exercise for you. Choose things that take effort and push you to keep your heart, lungs, muscles and bones healthy. This could be a fast-paced 20-minute walk. If you don't feel up to that, then start slowly and build up to longer, faster walks. Add to this exercise that targets your symptoms. Things like yoga, tai chi, dance, Pilates or Parkinson's exercise classes will help with movement, balance, strength and flexibility. Exercises that work the whole body and mind at the same time are really good to manage your Parkinson's. Try counting down in 7s from 100 while you walk. It's easy to become less motivated if Parkinson's makes your movement slower and exercise routines take longer. But try to focus on the rewards. Keeping your body fit will help you carry on doing the things that matter, like playing with your children or grandchildren, or carrying on with work commitments or favourite hobbies. So, what are you waiting for? Woohoo! Go for it and get moving now.
All right, so what I liked in all the research, yes, I knowing I had to do this, I read about, I read recent articles, and it was interesting that there was the same sort of comment, exercise as a drug. Yes, the medication in Parkinson's is very, very important, but exercise can play just as an important part. Research actually showed that it can manage symptoms, you can control it, and even decrease symptoms, decrease progression of symptoms. Yes, and the fact that it is clear that it does this is proof that we need to do it. This is like just someone with high cholesterol. At the beginning of it, before they put you on medication, they ask you to do exercise. Very often than not, if you do the right amount, your cholesterol lowers. Exercise is so important. But what this video shows is that it's important you speak to professionals, yes, so in this case a physio, but even other professionals. It's a social thing, it helps if it's social, so this is why something like the dance classes of Step Up, yes. It's important that there's this community feel. Or there has to be something you enjoy. So if someone maybe previously swam, yes, maybe doing something in a pool, maybe something a bit more gentle, but it has to be something, yes, enjoyable, something meaningful, with motivation, with a reward. Yes, these are all sort of concepts in motivation and interviewing. You have to find what that patient would enjoy to keep doing. Yes, and video also showed the two aspects of exercise. One would be targeted for your symptoms, so maybe you would need to do some Pilates, again, to get that extension in the back, but then maybe dancing just for fun and just to increase your step count, for example, and meet people and feel, you know, freer when you're moving. Okay. So I don't know why, okay. Yes, and this is a summary of all the benefits of physical activity for all. The physical is important in people with Parkinson's because we're moving less. Yes, your bone density may decrease. Yes, your balance is affected, so there's a higher risk of falls and fractures. Yes, so moving obviously counteracts this. There's the mental aspect, yes, mental health. Yes, people with Parkinson's tend to have sleep disturbances, mood disturbances. Yes, even I feel, you know, like it's a good run. Yes, I start my day right. Yes, it's when I don't, my mood is already, yes, but everyone finds their own sort of activity that they enjoy. Socially, yes, it's very, very important. You feel part of a community. Yes, again, if you're there with your carer, it's something simply you're enjoying, maybe chatting. Yes, not talking about, it doesn't feel like a therapy or a clinical setup. And also emotionally, yes, it improves self-confidence, self-esteem, self-worth, yes, and all those things. From that, I'm sure as clinicians, you've also come across this word in your work. Yes, it's very, very important we instill this in our clients. If they can't believe that they can do it, they will not. So if this, I mean, this is like when we would give them a task. Yes, we don't give them standing balance on one leg if we know they can't. Yes, so we adapt treatment and movement so they can do it and they feel they can do it, so they want to do it more. Yes, it's very important we instill this in our clients and to achieve success. Now, when we come to exercise, there are a few principles we need to consider. So not sure I can say it, specificity. So again, about targeting our treatment, again, is it the balance that's an issue? Is it the trunk mobility? Is it the rigidity and they just simply need stretches? Yes. Overload. So you have to, in fact, in the video they say it, you have to, yes, challenge yourself. Yes, and you have to maybe get a bit breathless. So yes, this is what we would teach young physios. If you're going to give them just 10 reps and it feels like they didn't do much, they're not going to feel the usefulness of it. It didn't cause any changes in the muscle. Yes, we have to push them. Yes, overload the muscles. Yes, to cause physiological changes to actually be successful. Progression, again. So if now they're managing, I don't know, 20-minute walk, or they do a nice good 10 minutes of exercises lying down. Okay, what are we going to do next? We increase it, we progress, increase the reps, increase the number of times a week they do it, etc. And variance. Variance is, again, you have to challenge the system and to keep getting improvements. Okay, so now we're strong in the legs. What are we going to do? We maybe push the balance now. It's very, very important to incorporate breathing techniques. Again, maybe this is something you're, the majority you're more familiar with, but it's very, very, very important. It's important because of, again, that trunk stiffness, the kyphotic posture, the breath, yes, and the lung expansion is in there. So it's very, very important to incorporate it both on a physiological level, even musculoskeletal wise, but also because of mindfulness, yes. Calming down. I mean, I'm sure you've come across all these breathing technique videos over the last few months, yes, to help us all deal with anxiety, and they work. Yes, you cannot deny it. Yes, we start every class with step up and finish with breathing exercises. Sets the tone, yes, but it can also be incorporated with exercise, yes. Breathing out on the effort and breathing in on the return. Cueing and prompting is very, very important. Explaining, giving a countdown, breaking it down. Yes, again, this is why, pardon me, dance tends to be successful because there's constant cueing and prompting. If not only from the music, it's from the teacher. Yes, there's the countdown. Yes, dance teachers, yes, we tend to sort of speak over the music, which is terrible when we're teaching children, but excellent when you're feeling the track and the music. We incorporate a lot of other concepts related to patterned movement, yes. So, for example, if we're lifting the arms, we're going to extension, then we're going to use the back. Yes, if your movement makes sense, in the sense if you know what works with what. You know, you can either work bilaterally, so lifting both arms, bending both legs, or oppositionally, like when we're walking, right across with left. But also patterned movement when we're coming into like flexion patterns or extension patterns, or what I like to call slings as well. This is like sort of Pilates, but yes, when you're doing a sit-up, yes, you're crunching, you're using your tummy, you want to actually bend your legs, you wouldn't extend it. Yes, so that sort of concept. And we must not forget range of motion and flexibility. Because of the rigidity, it's very, very important to incorporate stretches in everything you do, or dynamic stretches, so through movement, going through the full range, gaining lengthening. We must not forget our environment. So some of the symptoms or manifestations are shuffling and fascination. As you know, these tend to happen when we come up to obstacles. So for example, the beginning of a step or a doorway or a stop and start or a chair or someone is coming across you. When we're outside, there's so much we can control. Though we must not forget how unfortunately the environment is already setting us up with difficulty, whereas it should be designed to enable. But we can have control in the home or, for example, in a class setting. And it's very important to teach cues and movement strategies to deal with this, to minimize them and maybe minimize the risk of falls. Yes, like taking a U-turn, not turning suddenly. Men have a habit to turn backwards. I don't know, I always found this in my experience. I've never read it anyway, but they tend to go backwards as they don't like to go forwards. I think it's like a driving thing. It's instinct, I don't know. Yes, but removing carpets, even the way the homes, yes, needs to be home design. Yes, it needs to be sort of improved to avoid danger and facilitate movement. I mean, this is not just because it's Parkinson's. We do it, yes, with young babies. I mean, things are designed to help the mother move more easily, or the father, yes. I don't know, changing table, but yes, they're designed so, yes, movement is facilitated. And of course, it's very important to always seek professional help. Now, whether it's the speech therapist or the physiotherapist or a counselor or a nurse or the doctors, or yes, it's very, very important we do that.
Amy, sorry to interrupt you a bit. It's just that we're already nearly 20 minutes over the time. I mean, I don't mean to stop you, but I don't know how many slides you have. If maybe
No, it's the last one.
Fine, fair enough. Thank you.
I don't know what time I started, so I couldn't keep track.
No worries, no worries. Thank you.
Okay. So just to conclude, this is why class settings tend to work for people with Parkinson's. Yes, there's the social aspect. Yes, there's generally music. Both carer and the person with Parkinson's are there. Yes, there's all these things we mentioned that promote movement. It's interesting. Again, I've seen this in all aspects in physiotherapy. Because of COVID, we've had to go to telehealth and telemedicine. A lot of clients at hospital are actually using online means to connect with therapists, and it's really interesting to see because we're actually able to sort of help them more within their home and how things can, yes, still work even though we're away from each other. I think I can stop there because it's repetition. I don't know if anyone has any questions.
Thank you, Amy. I do appreciate that you all had a lot to say in a very limited time. So thank you all of you for your participation in the webinar. Shall we take some questions here? I know, Natalie, you wanted to do some part of a movement session as well.
Well, because we're quite over time, I'm not sure if this is a good idea. I think let's just go to the questions, and that's the best option.
Okay, I'll take your lead on this. Thank you. Okay, so I'm going to put forward some questions that were forwarded upon registration. Mainly, a lot of them are geared towards Roberta, related to the LSVT. One of the questions was, can we apply techniques from LSVT without being certified in it? And also another question was, is it available through government services? It came up on the chat. Maybe you'd like to answer those.
The first question, I'm going to answer the first question. I mean, we already apply certain techniques, even if you're not certified, like we focus on breathing, on pacing. And we also advise most of the time auditory feedback, so that when they have a low voice level, they can like record themselves and hear themselves speak and try to use a better breath support for them to speak and allow their voice. So in a way, we already do apply some techniques without being trained in it. But obviously, to apply the whole block therapy, it's ideally you should be trained in it, because that's the most effective way of how you can deliver it. So that was the first question. The second question, well, I think yes. I mean, if a therapist is trained, why not? I had 2 clients, 3, who I tried it with, so I think it's possible. And if the person is motivated enough to come for the sessions, why not?
It's
So
probably dependent on the SLP seeing the client.
The SLP and the location and the availability as well, because it's not always, I mean, if you're in a district clinic or in a health center, it's not always easy to get a client for 4 times a week for 1-hour sessions, you know? You have to be a bit flexible.
Okay.
But I mean, nowadays there's telepractice as well, so it can be done via telepractice, I guess, as well. So it shouldn't be a problem. But obviously, you have to be flexible according to what client caseload you have and whether you can manage it yourself or not.
Thank you. Another question was, what kind of support is provided for Parkinson's patients in Malta apart from physio, OT, and SLT? I don't know who would like to take.
I guess there's the list I mentioned in my presentation. There's Natalie's classes. There's the Malta Disease Parkinson's Association. There are the services offered by Active Aging. There are a series of them. I don't know whether you want to add
these references later on, as I said, so they will have them in writing as well. So.
I mean, and even if they look them up, they'll find them on the government websites. They're all available. So especially the Active Aging ones, so it shouldn't be a problem. But if you need other information, I can forward them to you, because I didn't list the support services as such in the resource list.
Okay, thank you. Another question is, how is it best to include family members in sessions and get them to actually do the work assigned at home?
So I think, if speaking from the perspective of the organization, I would really encourage, if you have someone in your family who has Parkinson's disease, to go with them, because to get them over that first step. And when you go with them, it's also good to interact together. And once they will come more often. And if you want to encourage them to do exercises at home, it's important to use music and make sure that they have a space. And for example, right now we have online classes on our website or on Facebook that they can follow live. So to make sure that they have the right technology to join in. But you encourage them to make things easier, as in technology-wise. Music is super important, and join in with them, you know, help them, to encourage them. It's important.
And if I can just add,
of course.
I mean, this is a whole profession in itself. Yes, counseling, motivational, interviewing. You actually have to do it case by case, see what their barrier is. Yes, it could be just a physical barrier, yes, no space, like Natalie said, or it could be like an emotional barrier, yes, they just don't want to do it. And then you have to overcome it, and you have to make them understand why they need to do it. There's no benefit. Yes, it's a balance of barriers and benefits. And you, as a clinician or a professional, you would help them find the right balance.
Thank you, Amy. I'm just seeing because something came up on the chat about the Malta Parkinson's Disease Association provides support in various ways, especially in providing information for people with PD and also health professionals. And they've put their email down there if anybody would like to take note. It's on the chat. Okay, one last question. I think Roberta will have to take this again. What type of therapies do SLPs use with patients with Parkinson's disease? I think you already went through that in your presentation, but part of it was also, do they see improvement?
Well, with the neuromotor exercises, they do if they're practiced. But again, it depends on the person, on the conditions presenting, on the conditions the person has. Because if the person has other conditions besides Parkinson's, it makes it a bit more challenging. So it's important not to, when you're providing therapy, it's always good to focus on various therapies, not just one, because if one doesn't work, use bits and pieces of everything, because maybe with some persons one thing works and with another thing works. So it's important that you find a balance. But with the neuromotor exercise tasks, yes, they do see improvement. I am not sure for how long though, since it's a progressive condition, like the LSVT. I mean, it's a progressive condition, so it's always changing. So you have to adapt to the needs of that particular situation and that particular person.
Okay, thank you. Okay, I think we can round it up here. It's very unfortunate, Natalie, that we could not take part in your movementing, but maybe we can all enroll in one of your classes one time. And
yes, of course. No, we have every day on the website, we have a class, anyone can join in. It's very easy, just go to our online movement classes, and we have every Wednesday and Friday on Facebook as well, a live session. So, but I'm sure they can all join, and hopefully soon we'll be back face to face with the participants, because that's what we really miss.
Yes, it was very emotional seeing that video. It's lovely.
Yeah, same here. I was like,
very nice. So I thank you and your team and for your participation in this webinar, and hopefully it's the start of many other collaborative
yes, definitely.
events together. So thank you very much, and thank you to all those that attended for the webinar. Thank you. So we are now going to play, actually, I just wanted to announce, during the COVID time, a group of speech language pathologists actually came up with a song to kind of create some motivation. So we're just going to put that on, and people can feel free to leave the webinar as they listen to it. But these are all speech therapists that are singing over here. So this is our part of
There's a place in your heart, and I know that it is love. And this place could be much brighter than tomorrow. And if you really try, you'll find there's no need to cry. In this place, you feel there's no hurt or sorrow.
There are ways to get there if you care enough for the living.
Make a little space, make a better place.
Feel the world, make it a better place for you and for me and the entire human race. There are people dying if you care enough for the living. Make a better place for you and for me.
And the dream we were conceived in will reveal a joyful face.
And the world we once believed in will shine again in grace.
Then why do we keep strangling life from the earth, crucify its soul. Though it's plain to see this world is heavenly, be God's glow. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. You and for me. Heal the world we live in. You and for me. For our children. For me. Heal the world we live in. For me. For our children.
Thank you, everyone, and good night.
Bye.